Part of our Telemed series, we're going to talk about heart attack today, and what to do in a Telemed practice. In our other videos, we told you how to set up the practice and everything. Today, we're going to talk a little bit about first aid, but let's introduce again what to do.
Hi there. Are you Penelope Waters?
Yes.
Hi, I'm Dr. Allison Crawford. I'm the psychiatrist who's going to be speaking with you today. Nice to meet you. I just want to tell you, I understand this is your first time meeting with somebody by televideo, so I just want to explain a few things about the process. One of the first things we do is always make sure that we're speaking to the right person. So you're Penelope Waters?
Yes.
And can you just confirm your date of birth for me?
Yes. September 17th, 1976.
Okay, great. Well, it's a pleasure to speak with you. We always make sure that people understand that although I'm speaking to you by camera, nothing's being recorded right now. And this is just as confidential as if you were in my office with me. So there's no one else in the office with me, and we make sure that no one else can hear what we're speaking about.
Excellent.
Okay, and at the end of our session, I'll be sending a note to your doctor.
Okay, great.
Okay.
So you can see rapport, confidence, confidentiality, these are all important issues as we're going to be doing our subspace telemed practice. But what happens if all of a sudden you start to find out that one of your patients is in trouble and that they might be having some type of cardiac signs? They might be having some type of a heart attack. Then what can you do? Well, first off, if you're going to have to recognize to call the emergency people. But today we're going to be teaching you what to do in more full terms, and even how to teach them how to do their own CPR while they wait. Let's learn more about what's going on.
Yeah.
Let's do that.
Oh, I don't think I could do that.
You okay, Jeff?
No, I don't think I am.
No?
Oh.
Alright.
So when your patient's starting to show some concerns, you have to kind of open up your eyes and start to talk to them about this. Let's learn more about the signs of cardiac ischemia.
A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack.
Okay, those numbers are from Australia. It's 911 in America and 112 in Europe. Be sure to be able to call for help first thing if there's any real sign of disturbance. Now, in a woman, shortness of breath, indigestion, fatigue, stomach pain, sleep disturbance, dizziness, discomfort in the back, jaw, neck, uncomfortable pressure squeezing in the center of the chest, and unexplained anxiety. That's for a woman. If you start to see these signs, if the patient has these signs, then it could be a problem. In men, uncomfortable pressure in the chest, in the center of the chest, shortness of breath, discomfort in the back, jaw, neck, nausea, fatigue, stomach pain, cold sweat. If you start to see these things, then you know that there's a possibility. But if they start to have extreme pain, like in the next video, then you're in trouble.
Right, Jeff, I'm going to need you to get down on the floor for me, please.
Oh, it's hurting.
All right, just lower yourself down. Right, Jeff, I'm going to get some help, okay? Right, Jeff, I've got you an aspirin. I'm going to need you to bring your knees up. It's going to help support you. I've got an aspirin.
I feel like I'm dying.
I need you to pop this one in your mouth for me, please. Open up your hand. Pop it in your mouth and give it a good chew, and then put it under your tongue. Ambulance is on its way.
Oh yeah, I feel like I'm dying.
Just deep breaths.
Aspirins are no longer used as a preventative because they cause problems in the stomach. So we don't really do them as a preventative. However, an aspirin at the time of a problem might help to thin the blood and create a little bit of help. Now also, alcohol can help thin the blood, but if the patient might be sick because of the alcohol, so you have to watch. There's other things that we could do as a natural agent. These things here are all blood thinners that could help to prevent a tragedy, but be very careful. They might create gagging, they might actually make things worse. And if the patient is sensitive to alcohol or is already alcoholic, then you could be in trouble for suggesting that.
That's it, well done.
If you suspect a heart attack, be sure to look for the 4 Ps. Pain in the chest, pale skin, a pulse that's weak and rapid, and perspiration. You need to act quickly. First, sit the casualty on the floor with their head and shoulders supported. Call 999 or 112 and ask for an ambulance. If you're in a care home environment, only administer aspirin if you're authorised to do so. Keep checking breathing, pulse and responsiveness. If the patient loses...
Your job now in the telemed interview is to do feedback. Recognizing that certain things are psychosomatic, mind-causing body problems, certain things are body-causing mind problems, some are psychotic. But you're here to now provide feedback while you wait for an intervention. Now here's a little video, very, very important, on CPR, so you can learn about how to help somebody do it at a distance. Or maybe you might even have to do this in the street or in your office or sometime. So watch this little movie about CPR and learn more.
Are you okay? Are you okay? You, call 911. You, get an AED.
This is a scene that plays out over 1,000 times every day in the United States. If you see or find an adult or teen who has collapsed, they could be in cardiac arrest, and you need to act now. Assess for any signs of movement or normal breathing. If the person has slow, deep gasps, this is not the same as breathing. Call 911 or direct someone to call. Treat. Press hard and fast on the center of the chest. Place the heel of your dominant hand directly on the center of the chest and interlock the fingers of your other hand. Keep your arms straight and lean over the victim, using your body to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second, or 120 times per minute. Allow the chest to recoil completely with each compression. If the victim is on a soft surface, like a bed or a couch, move them to the ground before beginning compressions. You may have heard in the past that you must do mouth-to-mouth ventilations. Mouth-to-mouth is not needed for adults or teens and could be harmful. Perform chest compressions only. However, mouth-to-mouth is needed for young children and infants. While performing chest compressions, direct someone close by to get an AED. The AED, or automated external defibrillator, is the only thing that will shock the victim's heart back into normal function. When the AED arrives to the victim, simply turn it on and follow the voice-guided instructions.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.
The AED will only deliver a shock to someone who needs it, so do not be afraid to put it on anyone who is unconscious. Now that you know how to act, let's watch this again.
Are you okay? Are you okay? You, call 911. You, get an AED.
Keep your arms straight and lean over the victim, using your body to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second, or 120 times per minute.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Shock advised. Press flashing shock button. Shock delivered. Start CPR.
In many instances, an ambulance or other medical professional can be 5 to 10 minutes away or more. Continue chest compressions while rotating compressors every 2 minutes until help arrives, and continue to follow the instructions of the AED or 911 dispatcher. You be the hero. Teach your friends and family to act now.
Yes, we need to act now, and you got to provide feedback. Now, here's how to now teach them how to treat their heart attack alone with the CPR while they're waiting for help. Please, you're waiting for help. Don't let them drive. Don't let them drive. You got to wait for help. Try to get a neighbor. Try to get somebody involved. Try to get a family member, etc. But you can now help them with these emergency acupuncture spots. The warrior spot underneath the nose, above the lip, and that little cleft there. You push in there very, very hard to produce a little bit of pain. And that helps for the heart. The hoku over here on the finger, in that web between the thumb and the forefinger. Push on that. That will help. Then there's another spot you see on the wrist for the pericardium. These spots will help. Okay? They will help for the pain, and they will help to stimulate the heart. Now tell them to take a deep breath and cough. That deep, prolonged cough, that will produce the same type of similar type of energy that they get for the CPR and help keep the heart going. Once every 2 seconds or so, and keep it going until help arrives, or until they basically feel a lot better. Tell them to rest, relax, and to tell them to do the cough, do the points, and you stay on the line and you give them feedback and you wait for them to recover, you wait for help to come, and you try to save a life. This is your job as a therapist. Now don't panic. Patient will pick up on your panic. Keep calm, keep relaxed, keep feedback, reduce the stress, and help save a life.